Bob Dannenhoffer, the Public Health Officer for Douglas County. It is March the 12th, 2021. We're now just a year into doing these Facebook Lives, and it's been quite the year. Lots of fabulous people that I've worked with over this last year, including so many of the people at DPHN. I think the people at the county have been amazing in their willingness to learn and then their willingness to help out. So I go around the state, and a lot of people bemoan the fact that, they never get to talk to the commissioner and they don't get the things they need. I can tell you here, we have gotten everything we need in almost every conversation I have with Commissioner Freeman, who's a liaison commissioner. Is like, yeah, if you need anything else, Bob, just tell us and we'll get it for you. And so we've been lucky in that way. But this time has been also sad. There have been all of these people, now over 50 people in Douglas County who have died. Hundreds have been hospitalized, and many of the people who survived their hospitalization still not back to normal. So a really heartbreaking story in the newspaper last week about the young nurse at the VA who spent such a long time in the ICU and is now just recovering. But the good news is I think things are looking brighter, and what I've told people is I think we're at a crossroads here. I think if things go well, we could have a really, really good summer. A summer that involves Pepsi floats, music on the half shell, a county fair could be great. On the other hand, the emergence of the variants is very worrisome, and we'll talk a little bit more about that today, about what that is. Again, things could go wrong, right? We could have a bunch of these variants. The disease could spread. The vaccine might be less useful against the variants, in which case we could have a bleak time ahead. I don't think that's likely, but I think it's clearly possible. So let's start, as we always do, at the world level and then move down. And then we'll get to your questions. We had a bunch of questions in Facebook questions. We always do those first. So if you really have a question that you really want to get done, put it in Facebook questions, because we can deal with very long questions in Facebook questions and complicated questions. When we're doing this live, it's hard to deal with some of those longer or more complicated questions. So at the world, cases were up and then cases were down, but they're going up again. And this is a real worry, because before each of the surges that we'd had, there were little scattered fires starting in different places in the world, and it's different places each time, but little scattered places where you saw places that it was previously under control just really grow. And now we're starting to see that. So cases in the last week or so in the world are clearly up. Deaths are kind of flat, but cases are up. And what we're seeing is there's a bunch of places in Europe, and Europe, again, preceded our big outbreak. So if you think of our big outbreak in the springtime, Italy and the UK and then the US. In the fall, it was Germany, France, Italy, and the US. And now it is France, Sweden, Estonia of all places, that are going up. Plus, we're seeing lots of cases in the Middle East. So Israel's had a big outbreak. They've done a very good job with immunization, but they're seeing a big outbreak, and now we're seeing outbreaks in the West Bank, in Jordan, and Lebanon. And then Brazil is really worrisome. Brazil had a lot of disease for almost a year now, and the thought is, well, everybody's going to be immune. We're going to get past this, and yet they're continuing to be just as bad as they've ever been, with more cases than anywhere in the world and more deaths than any world. So that is really, really worrisome, especially when we talk more about variants. In the U.S., case counts look like they're slowly creeping down and deaths are flat. There's no real hotspots. I mean, when you look around the heat map around the country, there are a couple of little places, but there are two that are a big worry. One is the Gulf Coast of Texas, and the second is South Florida. So it's a little warm in those areas, and that's a big worry because spring break is coming up. Spring break starts kind of next week and goes through the first week in April. And those are the two big spots. So Florida and South Texas are the two areas, and they've already got a fair amount of disease, and Florida already has a lot of variants. So we're a little worried about that. We're also starting to see New York. You remember New York had lots of cases in the springtime, recently gone down, about 3 weeks ago, opened up to indoor dining. They're starting to see a little surge now, so that's something to pay attention to. In Oregon, deaths are kind of flat, but it's kind of unusual. Cases are down, deaths are down, but Southern Oregon, which had always been the quietest part of the state, Josephine, Jackson, Coos, Curry, and Douglas have been really quiet. Those are really heating up. So Coos and Curry are the only orange places in the state. They've had a lot of outbreaks. So when I check day to day, it's in food processing plants, it's in schools, it's in workplaces, and we worry about that. In Douglas County, you'll remember we were really very way down in the beginning of January, started to have a big peak in February. We're down from that peak. We're still a little lower than the national average, but we're obviously much higher than we've ever been before. And what we're seeing is some outbreaks mostly in workplaces, schools, and churches. So workplaces, schools, and churches are the big time, are what we're seeing now. The nursing homes have been quiet, which is great, but workplaces, schools, and churches, and some of the workplace outbreaks are unusual because they're happening in places that have done a pretty good job with infection control, and yet it has spread quickly. So we worry that there might be some variants here. We have a bunch of specimens out for variant analysis. They're at the CDC, and every day we check, and they're still not back yet. But we worry because these have really spread in different places. When we track them back, we're able now to track them back several generations, and there's a lot of cases. So, for example, in one tire shop here in town, there's been a bunch of cases, even though they seem to do everything right. So that's a worry. Good news on testing is we have plenty of testing available. So anybody who is symptomatic should get tested. If you think you've got it, stay home, get tested. Vaccine, the supply is starting to go up, and I'm so very pleased to report that next week we're going to get our highest amount of Moderna. We're going to get a high amount of Pfizer. We don't know yet about the J&J. So for this first time ever, we've been able to give the places that give vaccines in Douglas County almost as much vaccine as they want. I haven't heard back all the requests, but almost as much vaccine as they want. And today we enrolled our 50th vaccine provider in Douglas County. So we have 50 places in Douglas County where you can get the vaccine, including now almost all the clinics. It started off being just the bigger clinics. This next couple of weeks, we're going to be adding more and more clinics, and we're adding more pharmacies. So this week we added Sutherland Pharmacy, Reedsport Pharmacy, in addition to Bi-Mart in Sutherland, Bi-Mart in Roseburg, Bi-Mart in Winston, Fred Meyer, Costco, Albertson, Safeway, Rite Aid, and then Gordon Drug down in Canyonville. So we really have a lot of different places to get vaccine. And what I'm hearing from people is when they're eligible, they've generally been able to get vaccine reasonably quickly. Not as fast as everybody wants, but reasonably quickly. One of the things I will point out is that we are having an event tomorrow at the fairgrounds. This is for people 65 and above. We still have some openings. So I'll ask Chris to put this in the chat section here with the link, and you might still be able to get one. So there were 15 slots when I checked at 3:30, so there may still be some openings. What we're seeing on that is some people wind up canceling, something comes up, or whatever. But it really does look like if you want to get one, so they have Pfizer vaccines open, and you could maybe get one tomorrow. It's likely to close while we're talking. In addition, I've had dozens of people say, oh, could I just show up and see if I could get one? Well, this is done. This is done to the minute. So we have this planned out to the minute and to the last vaccine. However, things will happen. People's cars will break down. They'll wake up tomorrow sick and not want to come. Something will happen. And so it is possible that there could be some extra. And if you're just absolutely dying to wait around, what I'd have you do is come not earlier than 1:15. So come at 1:15. We'll get the people. We'll line them up if there are extra vaccines. I don't think there will be, but I can never prove what people will or will not do tomorrow. So again, best to sign up, because if you sign up and get an appointment, you're guaranteed a vaccine. And I think it is so well arranged. I didn't have much to do with it, but Brittany and Teresa and Wayne that arranged this did such a great job that I'll bet that people do not wait very long at all tomorrow for their vaccine. We're going to be doing it again on April 3rd. And when we do it on April 3rd, we're going to be giving vaccine to second dose for people who got their first dose tomorrow, and then we'll, depending upon how much vaccine we have at the time, and there's no way for me to predict what we're going to have on April the 3rd, we may be able to offer either additional Pfizer vaccine or additional J&J or both. All the vaccines are great. Interestingly, in this time, we had more people wanting J&J than the Pfizer. Kind of interesting, because we thought it might be the other way around, but all the J&J slots were taken at 3:30. There were some Pfizer slots open. All right, so let's go to the questions here and see what we've got. Gotta find it first. So every day I get about 400 emails, so I had to look through my 400 emails to find this. Okay, so here we are. So someone said, I read that the mRNA, which is the messenger RNA, in the Moderna and Pfizer vaccines affects the cells in the area of injection to promote antigen development and antibody response. That's true. So when you get the vaccine, you get it in the arm. The reason you're getting the redness and swelling in the arm is that the cells around there are the ones that have taken in the mRNA and are now making the protein. They're putting the protein on the surface of the cell. They're putting protein on the surface of the cell and then making an antibody response. So is there any advantage or disadvantage in getting the second shot in the same area, or is it preferable to get the second jab in the other arm? A great question. Not answered in any of the studies, so we do not know the answer to that. But as a curious person, I would love to figure that out. And there's a way to figure it out, actually. You'd study 100 or 200 people, and you'd give half of them in the same arm and half of them in the different arm, measure antibody response, and then see if there's any difference. So it is a great question that I've thought about myself, but we do not know the answer yet. In the past, with other vaccines, it doesn't make a difference, but in the past, these were not mRNA vaccines. So this is a very long question, perfect for the Facebook questions, and so we'll do this. So in our review, we talked that 400 cases have been tied to households. So how many of those cases have been tied to the member of a household transmitting COVID to someone outside of the household prior to diagnosis? I don't have that number right here, but it's a relatively good number. Big number. So what we typically see, somebody gets diagnosed with the disease, they typically have a few contacts at work and may have a few other cases at work, and then they have contacts at home, and sometimes none, but usually some or all of their contacts there get it. And usually the diagnoses come in around the same time because the person has the disease and we do the investigation to both home and work. Again, usually by the time people get tested, they've been sick for a few days. And since they've been sick for a few days, many of their family members are already exposed and they come up with it in the next. So if there are lots, should you reconsider the policy to not quarantine household members when one member is diagnosed with COVID? I don't get that because we do, so that if one member of the family has COVID, the whole family should quarantine. So anybody in the family, anybody in the household has COVID, everybody else should quarantine. So what is the incidence of false positives in the COVID testing that's now available to Roseburg Public Schools? So the Roseburg Public Schools are using a test called Binax now, which we have a lot of experience with. We think actually the number of false positives is very low. We actually had the opportunity in one of our outbreaks to do both Binax now and very sensitive PCRs on them. Every one of the Binaxes that were positive on the PCR. Every one of the Binaxes that were negative on the PCR. So we do not think there are very many false positives. So it could happen. The worst study I've seen suggested it could be a few percent, but we're very impressed with the antigen testing, which is what the Binax now is. We have been very impressed with that. It is not good with looking for asymptomatic people, and it's not good maybe on the first day of your symptoms, because the way the PCR test works is it looks for RNA, and it can find tiny, tiny, tiny bits of mRNA. So it comes positive early, and because it finds tiny bits of mRNA, it can be positive for days or weeks after you're over the infection, because there's still some of that messenger mRNA in your nose. And so the PCR is sensitive early and late. The rapid antigen is great. By the second day of symptoms, it's been great. And so I do not think there are going to be many false positives in that testing at Roseburg Public Schools, since they should only be testing people who are symptomatic. So if one member of a household is fully vaccinated, and it's been 2 weeks since their second vaccine, so they would be considered to be fully vaccinated, and their high-risk child, who is under 16 living in the same household, is not, then what is the risk of the fully vaccinated person gathering with other vaccinated people and transmitting COVID to the high-risk child? So just recent, some data came out today from Israel, where they looked at the Pfizer vaccine, so not the Moderna or the J&J, but it showed that it certainly decreased death, it decreased serious infections, but it also decreased asymptomatic infections by more than 90%. So that's the good news. So their risk of transmitting COVID to their child is certainly less if both you and others are vaccinated, but it's never zero. So remember, my disdain for people who say this is safe or not safe, when I say that some things are safer or not safer. So if everybody else is vaccinated except for the high-risk child, the risk is much lower than if you weren't. It's still not zero. And so you need to recognize that with COVID, because of its unpredictability, there's no zero risk, but it's pretty low risk. So our family is thinking of having a family reunion in June in Nebraska. So family will be coming from Oregon, California, Iowa, Texas, and Arizona. So what do you think about that? Well, what you're doing is you're mixing, assuming that people are there, you're mixing at least 5 different households. The one from Oregon, California, Iowa, Texas, and Arizona. 92-year-old mother wants to go, so 92-year-old is high risk. People are vaccinated. That's a good thing. It's certainly much better than if you're not vaccinated, but still moderate risk, right? Because you're coming from 5 parts around the country, any which of them, who knows what the disease rates are going to be by then. So you're setting it up now, and by June, there could be no disease in any of those places, in which case it's low risk. On the other hand, you're coming from these 5 different areas. Right now, parts of Texas is a high-risk area, parts of Arizona are high risk, parts of Oregon are high risk. So this is moderate risk because you're bringing people from all over the country with a very vulnerable 92-year-old. My mom's 91, so we have the answer. We have a similar situation. My brothers and sisters are in Oregon, New York, Michigan, and Virginia. I don't think we're planning a trip this summer for that reason. So for me, it exceeds my risk threshold. For others, it may not. So Nicole says, if I'm fully vaccinated, can I go to the gym with proper guidance followed? So again, if you're fully vaccinated, your risk is so much lower than if you hadn't been vaccinated, so that's good. Going to the gym is a good thing. It helps to work off stress and gets you healthy. And so I think going to the gym is one of those things you can feel comfortable with. I still would wear a mask, still would do the other kind of things that you do in the gym, but I think this is one of the things you can feel more comfortable with. It was not addressed in the CDC guidance. So the CDC guidance for vaccinated people only had 3 things in it, and they've gotten a lot of crap because they were supposed to have more, and maybe next week they'll do that. But at least this week, they have 3 exceptions, and I call them the grandmother exception. If you're vaccinated, you can visit your grandkids who may not be vaccinated if they're low risk. So that's a little different from the previous risk question because the child was high risk. So our grandchildren, our 3 grandchildren, are beautifully healthy, and so they're relatively low risk. So fully vaccinated, I could visit my grandchildren. The second exception is the dinner party exception. 2 vaccinated couples can can visit comfortably without a mask if they're all four are vaccinated. And the third is the quarantine exception, which is that if you've been fully vaccinated, you do not need to quarantine either after travel or after an exposure. So that's a great thing. So Casey says, if the country receives more vaccine than people who want them, what would be the outreach to other people who might not be eligible? I just heard today as I was driving in here that there is an agreement among a group of countries and whatever about what we're going to do when we get more vaccine than we need. This is going to be a big issue because many of the countries who we think are going to have the biggest troubles do not have a lot of money to buy these vaccines. So when I look at the amount of disease in Brazil and Peru and Argentina, it's just really worrisome, and they're really, really going to go ahead and do that. The other thing is that Africa has had very little disease, and for those of us who worry about things, our big worry is that the disease will now start to spread in Africa, and Africa, a really, really very poor area, is not going to be able to buy the vaccines. And if it really spreads in Africa, and now you start getting mutants which are vaccine resistant, those mutants can come back to the US and we could go through this again. So that's my big area. So the question then is, if the county receives more vaccine than people who want them, what's the outreach to other people? My goodness, I'm getting all these phone calls. What's outreach to other people who might not be eligible? So the governor had a press conference today, talked about on March 29th expanding it to other eligible groups. We think over the next few weeks we're going to basically hit all of the eligible people, and then starting March 29th it's going to expand to others, those between 45 and 65 with underlying conditions, which is most people 45 to 65, and then to other high-risk people. So we're doing it. So Veronica says, are you concerned that cases are going down because you're only doing one drive-through a week? I don't think so. Actually, our testing is actually up. The testing that we done at the fairgrounds was getting less and less popular because it's a deep the test we do requires a deep nasopharyngeal swab and takes days to get back. Most people who are getting the test now are choosing the rapid test, which is just in the front of the nose, and you get very reliable results in 15 minutes. So I don't think that's why it's going down. Our test positivity rate is up, but our total number of tests is also up. So if a county receives more vaccines than people want them, what will be the outreach to? Oh, I read that. So again, in Oregon, the vaccine is given by the state, and people from outside the county can come in and get it. There's still a bunch of counties in the state that are really struggling with vaccines, and I would not be shocked if some of those people showed up tomorrow. When I looked this morning, about 99% of the people were from Douglas County. So again, most of the vaccine we're given is for people in Douglas County. Well, a few other things. Schools, the governor is really making a big effort to go ahead and open up schools. And so we're going to have new school guidance on Monday. Douglas County schools have already been mostly open, and for the most part, it's gone okay. We don't think there's been a lot of spread in schools, but we do think that we don't think there's been a lot of spread in schools, but there's been a lot of spread in stuff around schools. So heard about a huge outbreak today up in the Portland area that happened when a big outbreak at a high school, and it was traced back not to the high school, but to a party that occurred off high school grounds. Those kind of things will happen. I mean, I was a teenager in the last millennium, but I don't think that much has changed. And high school, especially senior year, was a lot about parties and about hanging out with friends and talking about what you're doing in the future. So it's not shocking that when school gets back in session, that kids will go ahead and do those things after school, and that's a bit of a worry. New thing also came out, which is about this study that was done in Massachusetts, and they looked to see what is the distancing. So the CDC has suggested 6 foot distancing, and to achieve that 6 foot distancing. They've asked Oregon schools to have 35 square feet, about 6 by 6 area for each kid so that they could be adequately distanced. Nice study came out from Massachusetts. Some of those schools had chosen a 3-foot distancing. Some of those schools had chosen a 6-foot distancing, and there didn't seem to be a big difference between it. So there may be a difference in the distancing, again, based on data that we didn't know before and we know now. The other thing that's come out is Astrazeneca vaccine. So the Astrazeneca vaccine is not yet approved in the U.S., and I don't think it's going to get approved for a long time because things keep popping up with the Astrazeneca vaccine. They had a medication error, they had some side effects that they couldn't explain, and now there's about 30 cases of what we call thromboembolism. So thromboembolism is where you have a clot then moves. The most typical thing that happens with is with a clot in your legs that moves up to your lungs, and then you wind up with a pulmonary embolism, which can be really, really, really dangerous. And so there have been about 30 episodes of that, mostly in young women who are otherwise most likely to get this, unknown whether it's from the vaccine or just it's those things that happen. So its use is being suspended in 9 countries. There have been no reports of these thromboembolic events, no unusual reports of this thromboembolic event with the Moderna, the Pfizer, or the J&J, so that's a good thing. So again, we're looking very carefully at these vaccines. More than almost any vaccine we've done before, we're very, very, very carefully looking at side effects, and so that you might see some things like thromboembolic events or something else is not surprising. So one of the things that's racing through the internet this week is that as a little over 1,000 people who'd gotten the vaccine died in the 4 weeks after they got the vaccine. Okay, well, I mean, it's about 1 million in Oregon, about 100 million around the country. So if you took 100 million people and just watched for a month, some of those people are going to die. They're going to get in car wrecks, they're going to die of cancer, something's going to happen to them. I've been trying to find out what the expected death rate in that 100 million would be. The expected death rate in the 100 million is high. There's about 7,000 people of the 330 million people who die every day in the U.S. So every day in the U.S. there's about 7,000 or 8,000 deaths and about 7,000 or 8,000 births, and that's why our population is relatively steady. So so 7,000 or 8,000 people every day among 330, you do the math, it's about per million, it's about a little over 2,000 deaths per 100 million. So that's not shocking. Then that's not shocking that you would then have 1,000 deaths in the people who got the vaccine. But again, this is where you need very sophisticated analysis, because most of the people who got the vaccine are older, and we're more likely to die as we get older. But you'd like to see that there's no unusual spike in any kind of disease. So for example, if you said, well, the total number of deaths is normal, but what we're seeing is a lot more deaths due to cancer, then you might worry that the vaccine has something to do with cancer. We've not seen that. But if you saw an increased number of deaths due to thromboembolic disease, you might say maybe there's a risk. We have not seen that. But that's the kind of thing that people should be doing. And unfortunately, it is much easier to plant a story like, oh my God, look at all these people who died, rather than do the careful analysis. At least the careful analysis I've seen so far suggests that the vaccines have been very safe and very effective, and we're giving some tomorrow. All right, let's see what else we got here. All right, so the other question was about spring break. Again, spring break is a real worry. Spring break tends to have lots of outdoor activities. And so when they show it on the news, they show all these people at the beach. I don't think there's much risk at being at the beach. So the beach is not really the area that I worry about. What I do worry about is that somebody comes from one of the hundreds of places that people will come from to go to spring break. They're carrying the disease and feel perfectly fine. They're in a hotel room with 6 others, which is the way they do it. And then they go to a bar with hundreds of others on the time that they're feeling well. 4 or 5 days into the trip, they start feeling sick. They get tested with COVID, and then you find for the last 2 days when they've been infectious, they've been around hundreds of people in indoor gatherings Those people then get it. They do another round. Those people then at the end of the week are contagious and spread it to a bunch of others. And then all of these people who are still feeling well go back to the many places around the country and spread it. And it's especially worrisome in South Florida, because South Florida is seeing a lot of the British variant, and the British variant appears to be much more contagious and more deadly. Now, it's not going to be deadly for the people on spring break necessarily, but they're going to come back and then they're going to go work in a nursing home. They're going to go back and do clinicals in their nursing program, and this is a worry. And I'm a worrywart, so it may not happen, but this is a worry that we have. All right, let's see. Any more questions? Well, I would love to be done early tonight. I've got a lot of work to do tomorrow for the event. So again, the event is going to be tomorrow. We're starting at 7. First vaccine at 8. We're going to go to 2. We're going to do 200 doses of the J&J, 500 doses of the Pfizer. We expect to have a great event. We're going to repeat this on April the 3rd. And April the 3rd is just when the newly eligible people get in there, and we'll get them vaccinated. Which vaccine should you get? Whichever one you want. I think there's not a big difference between the three of these in terms of their safety and efficacy. So one more question here is, now it's been 3 weeks since my second Moderna. Should I still be fatigued? Not really. I think when they looked at the studies on this, people had fatigue. Median time was less than 2 days. Now there were some large outliers, but if 3 weeks after your second Moderna you still feel fatigued, I would get that checked out, because if you got it because you're older, there's other things you could have. I mean, you could be anemic, you could be hypothyroid, you could be all kinds of things, and I wouldn't want to ascribe it to the second dose of your Moderna. And I would want to try and figure out what goes on. Unfortunately, what happens in medicine is you don't know for sure that there's not something else. But 3 weeks after the second Moderna dose is a little unusual for side effects to continue. And I get checked out and just look for the basic things: anemia, hypothyroidism, other kinds of stuff like that. So someone says, how do I send questions before the live event? So we have a special email box called Facebook Questions at DouglasPublicHealthNetwork.org, a very long email address, but Facebook Questions at DouglasPublicHealthNetwork.org. And one of our great staff members will look at the question, extract the question, and send it to me so I can do it the next time. And so if you send that now, we'll do these on the Tuesday meeting, and we'll get it through. The other thing I want to tell you is that 2 weeks from today is going to be Oregon spring break. It'll be the 26th, and our crew is going to actually be on spring break. Thank goodness. They're actually going to get a time to be with their family. So we're going to do something a little different that day. We haven't decided yet, but if you have an idea about what would be a welcome break from this, we could do best of, we could do a face-to-face talk, we could do all kinds of stuff. So tell us what you'd want, and we'll see if we can do it. So Darlene says, when will vaccines be available for children? I do not know. So vaccines for children are hard to do. Remember, they were doing this trial early on, and when they were doing this trial early on, they wanted to enroll them quickly, find out if they were symptomatic, and then see how well the vaccine worked. So much easier to do that with adults than with kids, and it's hard to sign up kids. So it's been taking a while actually to get kids signed up for the vaccine trials. It looks like the Moderna and the Pfizer will have some child trials this summer. So we're hoping that, if everything goes great, by July, 4th of July, all of the adults who want vaccine will have it. And then in July and August, we can do second doses on people who got them in early July and start to do kids. Probably in the beginning, it's going to start with teenagers, 12 to 18. And that's really an important group, because those are the kids who seem to spread it as well as adults. Vaccine for elementary school age kids is going to come a little later. We're not really started yet much on those trials. So Dr. Fauci has suggested that vaccine for kids up to age 12 probably not going to happen until 2022. That would not be shocking. Kids at that age do tend not to spread it as much as older kids. So I think working on the 12 to 18-year-olds would be a good start, and then move to the group other down. There's nothing to think on this vaccine that it should be any different in different ages. It's an mRNA vaccine. mRNA works from the moment of conception until you die. There's not a big pubertal change in mRNA and the way mRNA works. So we think that the vaccine should be safe and effective at all ages. It's just a lot harder to test things in kids. But that's not just for vaccines. That's for medicines. I will tell you, there are so many medicines that we use that really have not been very adequately studied in kids. They were studied in adults, and then you started using them in teenagers and seemed to work and be effective. And then you move down further. But it's really, really hard to study things, for example, in 2-year-olds, because they could have lots of side effects you wouldn't know about. Like, I've got blurry vision. 2-year-olds can't tell you they have blurry vision. I've got a terrible headache. They really can't tell you that. It hurts when I go pee. It's really hard to do that in a 2-year-old. And so many of the side effects that you'd be looking for in a 23-year-old are really, really hard to find in a 2-year-old. So the studies that we have on medications in kids are terrible. The other group is pregnant women. The good news on this one is that there have been about 30,000 pregnant women who've gotten a vaccine, and they seem to be doing great. So Paul says, does being vaccinated reduce the chance for variants to spread? We definitely think so, and especially the Israeli data that just came out, that it decreased all sorts of infections, asymptomatic, symptomatic, severe, hospitalized, and death. It seems to stop all of those. So yes, we think it stops. So the variants spread while the variants can only spread while there's disease being transmitted. So when there's no disease being transmitted, there's not very much spread. And if you think about the places where we've seen these variants, the UK, South Africa, Brazil, Southern California, all of those places where there's a lot of disease spreading. So again, variants spread while there's disease spreading. And that's why the maps of South America and seeing so much disease in Brazil and Argentina is really, really, really worrisome. So yeah, if we can get everybody vaccinated, as soon as we can get them vaccinated, it can help the variant stop spreading. There's a brisk debate. Would we stop spread quicker if you gave everybody one dose rather than waiting for the second dose of the Pfizer Moderna? Or would you do better to stop variants by doing second doses and having people more fully immunized? That is an incredibly vigorous scientific debate that nobody knows the answer to, but maybe someday we will. In any case, we're doing okay here. Our case counts are coming down. Still seeing those worrisome outbreaks that are spreading faster than seems usual. And we're still waiting on our variant analysis because there could certainly be some variants there. But in general, things are doing well. The weather is getting better. It's easier to do things outdoors. Again, if you're planning an event, if you can do it outdoors, it's so much safer than indoors. At this point, an outdoor event between two vaccinated couples is almost like is a very, very low risk event. And so that is a good thing. The bad thing is the variants, if they rear their ugly head and are as bad as we think, they could be terrible. Now the good news is a lot of variants in the UK and South Africa. And while they had a terrible time of it in December and January, both seem to be past it. That's the good news. The bad news on the variants is that Brazil, which has also had a lot of variants, doesn't seem to be past it. And so I don't know how this is going to play. I'm not very good about predicting, especially about the future. So it's a little hard to know. But in general, we're doing a good job. Keep going with the masks. Keep going with the distancing. Be careful for yourself. One of the big things we've seen in the last few weeks is sick people spreading this. And so really, if you're sick, stay home. We in the United States have this sense that we work through it. Right? You got a broken leg and a sinus infection, but I still went to work anyway. And that may be the right thing before and when we're done with this. But now, if you're sick, stay home. So, for example, in one of our outbreaks, somebody said, I was just this nasty cold, and went to work and turned out to have the disease and spread it to a bunch of others. So again, if you've got a sinus infection or nasty cold, really, really stay home until you're feeling better, because that's been one of the ways it spreads. But overall, people have been incredibly nice to us. The Zonta Club did a little thing for DPHN this week about all the great work that all those people at DPHN have done, which is great, as well as all the other people on the response team. So when we do this here, I get to do it, but there's so many people at DPHN who are working with this, getting me the data, answering the questions. And then, as you remember, in Douglas County, our public health is a county function, and they contract out the activities to DPHN, but the county remains that, and the county is basically funded much of this event. So this weekend's event is totally free. We're not charging anybody, but there's a charge for the fairgrounds, there's a charge for the traffic cones and all the other things we need to do, and the county has been providing the funding for many of those things. So we want to be incredibly grateful to them, and I want to be grateful to the people in Douglas County. People in Douglas County have done a great job. We've not always agreed, but when we don't agree, people have been civil about it. It's been great. So I'll sign off. I think that's the last question. I'll just say, as I typically do, be safe and be kind. Thanks.